Now, what is key to understanding some of the fungal infections is going to be diagnosis. And how are you going to diagnose a lot of these? You're going to have to know a little bit about the morphology. One of the really important things that they like to ask you about as far as fungal morphology is to know the fungi that are dimorphic. So what does dimorphic mean? That means that you have two different shapes, dimorphic. So dimorphic fungi are molds at 25 degrees, and they convert to the yeast form at 37 degrees. So what I like to say to remember that is it's a mold in the cold and a yeast in the beast. Mold in the cold, yeast in the beast, dimorphic fungi. Now, which fungi are dimorphic are listed here. You have all the systemic fungal infections, histo, blasto, and coccidio, and additionally, you have sporothrix. Sporothrix schenkii is actually a subcutaneous fungal infection. I'm not going to go through all of the different morphologies here in the beginning. I'm going to talk about them with each particular agent as it becomes easier to associate with that particular infection. One more thing, though, before we pass on. The mnemonic for the dimorphic fungi that can help you remember them is body, heat, changes, shape. So the mnemonic itself tells you what happens, and you have body, blasto, heat, histo, changes, coccidio, shape, sporothrix. Okay? This next slide lists some of the different spore types, and again, this is not anything you have to spend a whole lot of detail on. So as we go through each particular organism, we're going to look at yeast forms, we're going to look at arthroconidia, but until we really have a good idea of what those are, it's hard to make an association for them. Now, diagnosis for fungi is a little bit different. One of the things you're going to see is KOH mount. KOH mount. So a lot of the cutaneous infections, one of the things they'll do is a KOH mount. And all this is let's say I have Tinea versicolor, which usually is pretty easily diagnosed clinically. But let's say I go in to the physician's office and I say, well, how do you really know that that's what it is? And they say, okay, we can do a KOH mount. And what they would do is take the area of my skin that was affected with that particular fungal infection. They would scrape off a little bit of my skin with probably a glass slide and let the flakes fall onto another slide. They then digest the skin with KOH. And what that does is it chews up the skin and it allows the hyphae to come out so you can actually determine morphology. There are a few different stains that we can use for diagnosis for fungal infections. The PAS, which is the periodic acid shift stain, the silver stain, which is used very frequently for pneumocystis, and then a calcifluor white stain, which is also used. So there is different stains that you can use to detect and diagnose the different fungal infections. India ink is something that's done that is similar to when, let's say, we talked about capsular diagnosis before. We talked about a quelling reaction, wasn't really used anymore. Well, India ink can detect encapsulated organisms, and the ones that we typically refer to is Cryptococcus neoformans. However, the India ink stain actually is fairly insensitive and misses about 50% of the Cryptococcus because it's not as specific for the capsule. So now mostly we've replaced the India ink stain for Cryptococcus neoformans with the latex particle agglutination that we've talked about for a lot of the other encapsulated organisms. A couple of other clues as far as fungal diagnosis is concerned. They do culture them on a specific type of agar called Sabarod's agar, or sometimes you'll hear it referred to as Sabarod's dextrose agar. And what this agar is it's a particular media that helps inhibit the growth of bacteria to allow for the growth of fungi. Because if you were to culture something that was contaminated with bacteria, as a lot of the sites in the body are, the bacteria would overgrow and outgrow the fungi, using up all the nutrients before the fungi would have a chance to grow. Diagnosis, a lot of what we're going to talk about today is going to be based on morphology. So I'm definitely going to focus you in on the morphologic characteristics of fungal diagnosis.